Real talk.
Welcome back.
Okay.
Welcome back. Part 2. I think we left on a good cliffhanger.
Yeah, vaginas.
We stayed on the outside, and now it's time to enter.
Time to go inside.
Time to enter the cave of wonders.
And I'll bite my tongue.
Yeah, so we started with just super recap. Everything on the outside of like a female pelvis is the vulva. And then once you kind of go inside, I know it's just not like a very...
Scale's different.
Scale's different. But you go inside that canal, and then we kind of like... We pass through some of like that muscular tissue, so you kind of actually get into like the pelvic floor, like that hammock of muscles, and then even inside lives not only let me get more people, let me get everybody together. Okay. Not only lives our bladder, where we pee stored, and then urethra, and then our rectum where poop is stored, anus that comes out, but they also live on either side of that vaginal canal.
Very tightly packed.
Super packed.
And then you have the clitoris that
kind of like, it's kind of here.
Yeah.
Yeah, it's kind of like on the outside. Still kind of like that outside inside structure, almost like that door jamb structure.
Sure.
I guess, yeah. Or like a, I don't know, like a wedding piece.
Like an arch?
Like an arch, yeah. Like an arch,
hopla?
right? Yeah. Like trying to think. Like,
Yeah.
Yeah. And so I think like just when we do talk about like internal anatomy, like yes, the vagina is like super important, but like if you're having bladder issues, meaning like you're having pain with peeing, or you have to go pee every 20 minutes, or you go pee every 12 hours, or if you're constipated and like you poop every 5 days, or you can't stop pooping your pants, those are super important because they do live like on the outside of that vagina. They live super close to the uterus. They have attachments to all of these things, so they can kind of be pulling and twisting and moving things from inside.
Right.
Because then once you kind of like travel up into the vagina, I always just like love this this one in particular, because, well, it's mine, but like my daughter would like play with this in the back seat of the car, and like she literally acted like it was like a little spaceship or something. It just looks so crazy.
It kind of looks like one.
But so inside, then we have our uterus, which that, kind of like when we're, I don't know, teenagehood, adulthood, it's the size of your fist. And then if you were to kind of get pregnant, this thing's going to blow up and kind of get huge and carry that fetus. We have our fallopian tubes, and then we have, our fallopian tubes, and then we have our ovaries. And that's where all like the ovum, the eggs are kind of kept and stored until they're ready to kind of like maybe meet a sperm, maybe not, and then maybe like leave the party as blood. So that's kind of that like internal anatomy, which, when I teach that to kids or even just to adults, again, like it's just so important to just kind of understand all the pieces, how they all just kind of fit. And then that's not even including like then to an extent, like the intestines are kind of like just slopped on top of all of that, and so that's going to kind of play a huge role too.
Sure. And Dr. Kelly, you mentioned, your daughter will play with that, and it's sweet, right? That's very sweet. I have 2 daughters. And some of the questions that they're asking, it's I always like to give them, the best truth that I know. Right? I don't try to sugarcoat too much, but I chop it up a little bit if I need to. Could you talk to us a little bit about kind of like age development and like what are like milestones or keystones within like the body as it ages with kids and stuff in this context?
Yeah, I'll definitely kind of start that, and then I'll definitely pass it over to Dr. Leslie. So the way I even kind of think of it too is just like we're so focused on it when they are like that 0 to 1 of just like that's the first thing and the only thing I think that the doctors even like really cared about, the first couple of appointments, like how often are they pooping and peeing, just like how everything's kind of growing, like you have all your gluteal cleft stuff, like we're looking at just like kind of like all their private areas like really intently the first couple of checkups, and then they kind of get to potty training and like no one ever asked me anymore about it. So then I'll kind of like defer over.
Yeah, well, and I've learned with sonograms, fetuses in utero are touching their genitals. Like it's a feel good thing, pleasure, and as adults, we start to tie that to sex, but it also can just be a feel good. It's not a sexual expression. So like kids by the age of 1 are touching themselves down there, and this is where I work with parents of it's really of how we're reacting when that's happening. Of are we freaking out? Are we Are we making it more than it is? You know, it's really common for, you know, those 3 to 4-year-olds, 5-year-olds to play doctor. I'll show you mine, you show me yours, because they're just curious. So this is like, we're talking about talking to kids developmentally, like, we're teaching them everything. We should be teaching them the proper terms. You know, if they're an individual with a penis or they're an individual with a vulva, of what that is. And some parents are hesitant because they feel like that's going to make their kid grow up too fast. And I'm like, it's just a body part. And it also can help you as a parent, because if you know, if my kid comes in and says, you know, my labia hurts, or my vulva hurts, then I'm going to know more versus it just hurts down there.
Absolutely.
Going back to what we were saying in part 1 of like the more specific we can be with doctors.
Yeah, the faster we get help, the easier we get help, and
or
then
get referred to the right person, or any of that. And then as they grow up, you know, it's not uncommon for, you know, 5 to 7, they start wondering where babies are coming from, especially if they're seeing either their own parent pregnant or their, you know, their friends, you know, mom's stomachs are starting to look a little weird. And they might be with the genital touch, like that might still be a calming thing for them. So it's really just talking with them of like having that what we do in private versus public, right? So it's like that it's not bad, but like that's something that you would do in the privacy of your own home. You're not going to do that in the middle of kindergarten.
So just to be clear on that, you know, if a parent or a guardian is seeing their young one, you know, exploring their bodies and touching themselves at the earliest of ages, it's no time. It doesn't mean that your child's a perverted.
No,
you don't have to call, you know, and do the holy water or sex therapy. It's natural.
It's natural because they're very curious. Just like they're going to be curious about anything. You know, it's just a curiosity thing. And most of my adult patients who have issues with shame or anything like that has a lot to do with how their parents responded at that age, right? So you know, if mom walks in on little Emma, you know, with her hand down her pants and she just like, don't do that and is very, you know, upset, well, that 5-year-old Emma is going to carry that forever of like, I did something wrong.
Right.
And I don't really know what I did wrong, but now I'm going to associate with like, this area is bad.
Correct.
Right?
Yeah.
Now, obviously, you want to keep an eye on if a kid is constantly touching down there. You want to make sure there's not a problem, right? Like, is there, you know, is there something wrong? But it is just a feel good sensation. It's why, you know, adults, masturbation can be a stress releaser. You know, it can be that feel good, but it's not a sexual act for kids.
Yeah. Well, just as you identify different things, like we're all excited about the milestone, you know, where we like learn what our toe is and like what our hand is. We're excited about that pediatric milestone. But then you start, you know, they reach down and they're also trying to like touch themselves while you're changing them. Well, you're touching it too.
Right.
You're trying to clean it. So like, just explain in that moment, even when they're just even a couple months old, just kind of getting into that habit is it's just
normalizing. These are just body parts.
This is what it is.
It's body parts.
And speaking of body parts and normalizing them, Dr. Leslie, talk to me about what you call them to the kids, because I know that some parents or guardians may want to make it seem not as technical, but at the same time, if you call it some, you know, you're floofy, then it makes it less serious in a sense, and of course, it is a serious thing. Right.
So you know, with me, I sometimes that would be when I work with the parents of what is your hesitation with it, right? Like with a depending on what the kid is. Like I might with a 5-year-old, I don't need to get into labia, majora, and minora and clitoris, but vulva versus vagina. I think testicles versus penis, like those are basic, just like I would say this is my elbow and this is my knee. Like they're just body parts. And it's a lot of times it's not so much the kid because the kid just, shame is learned. Right? So the kid is just curious. And a lot of times I am working with the parents of like, how do we work through your own anxiety or shame about it? To be able to teach your kid the proper terminology. And as they get older, right? So like as they get older, elementary school, they may want more privacy, right? So they want to go to the bathroom by themselves. And that's why it's even more important to teach them so they know how to clean themselves properly, right? So they don't cause any issues. And then once we get into, you know, teenage years or puberty, you know, the talk, right? We got to talk about Sex. We got to talk about potential STIs. For kiddos with uteruses, we got to talk about menstruation, sometimes at an earlier age than we expect, because girls are having their first menstruations a lot
Way
sooner.
earlier. Yeah.
Why is that? Because it seems like, back in my day, it was a certain age range, but now it just seems like it's getting younger. Is that environmental, hormonal? I mean, if what we eat, what is it?
Yeah.
I've always heard of because me personally, I was in gymnastics as a kid, so like I was a late onsetter, not complaining, and I always heard from my doctor that it has to do with a certain percent of body fat before the estrogen kicks in. So there might be that of that's always heard. That's why like gymnasts in general or athletes typically have delayed periods, because they have so little body fat to trigger the hormonal.
Yeah.
That's what my doctor told me, so I'm trusting them.
Yeah, there's a few reasons. I think a lot of it too is kind of like sort of the stuff that we can't control. So it's just like air quality, water quality, food quality, like what we're eating. I'm not going to go down like a tangent of like if it's what's in our food and all this stuff. But I mean, just the basic thing, like just food and air, like where you live, like what you're breathing, and then the stress of that environment. If you have access to healthcare, like, do you have food on the table? Or are you like running around and like, maybe I get dinner tomorrow?
And also the quality of food, because if it is tied to percentage of body fat, like we know the cheaper foods, carbohydrates and those kinds of things can increase of that too. And also, like, I haven't looked into it, but it's like, is it just American girls, or are European girls having the same trend?
Yeah.
Maybe we need to do a whole nother
it is, session
on
that. Might be a
that.
whole other thing. I think it is kind of like more like America. We're just doing the research on it, That's what we're kind of seeing. But yeah, they kind of like that idea of like that female athlete triad, which now they call it like the REDS, like the relative energy deficiency in sports. Is definitely tied to like bone density. They call it like energy availability now versus like eating disorders. And then, like the presence of like your period or not your period. And then a lot of also periods in menstruation too is also like hereditary, so if your mom had an early period, like you'll probably have an early period, if you're, it kind of goes down the line.
Yeah. It's very complex.
It is very complex.
But it goes back to if it's, if I had a daughter, right, just because mine was until I was like in my late teens doesn't mean hers wouldn't come early. So I think it circles back to like why it's so important to have these conversations, because you don't want to have the 10-year-old girl in elementary school and just freaking out of what's going on.
Or her friends are having it.
Right.
So it doesn't matter if like, your daughter or your niece or whoever is kind of like having their period, like their friends could be having it. And then they're going to have like a very blunt introduction to what that is without knowing, when like it's just good so that nobody's scared. And then you kind of don't like that, going back to like that shame and just like, oh my gosh, it's happened to me, but none of my friends, like now I'm alone and like I'm the outcast, because this is a different thing. Like, no, it's actually a really healthy, normal, awesome thing. It's going to help with bone development, brain development, muscle development. Like getting your period's actually really great. And if you don't have it, like, and you're not pregnant, like, there could be a problem.
There could be a problem. Well, and we're focusing on girls, but it's also important for, I would even say, of education for boys, or vice versa. If you have a girl, educating on boy stuff, and then if you have a boy, education on girl stuff, because it's they're gonna have friends, or they're gonna be interacting, or just like knowledge themselves of what. I've seen so many TikToks of guys not knowing how like a tampon works, and they're like, in their 20s, and it's like we laugh at it, but I'm like, I think that means we failed a little bit in education of like, it's the human body, and yes, it's good to know your parts, but it's also good just to know the other parts that are involved.
Absolutely.
Yes, and also how they're all tied together. It's like we were talking about like in fetal development, like all these parts kind of, they start the same, and it's the hormones that make it turn into ovaries or testicles or all the indoor versus outdoor plumbing going on.
It's what, like around 7 weeks or so after conception, everything, every living thing is the same essential being, an organism at that point, right? I mean,
same parts.
Yeah, same parts.
And then that's when you get like the testosterone or the estrogen blast, as I call it. And that's the instructions. The parts are just waiting around going, what's the next step?
Do you say testosterone or estrogen blast?
Huh?
What was that? What did you say?
Testosterone or estrogen blast.
That sounds like a new like Mountain Dew flavor or something.
Exactly. I'm surprised it's like not. Yeah.
But that's the instructions for it to, it goes to those cells that are developing, and then it goes, we form into, here's our blueprint, and this is what we turn into. And that's where, if we're talking about like intersexed, individuals, where they have the mixed messaging. So it's like they have, is it like XXY? And then they can start turning into one or the other. Like I've heard of like, it looks like a vagina and all that stuff, but it's just a hollow like a tunnel, like because there's no ovaries and they actually have testicles there. So like I think it's a miracle of like just when you think of the cells just dividing and dividing and dividing that we don't have more issues. But it is known of like it can go awry at sometimes.
And I mean to emphasize that too, we're talking about something that is naturally occurring. Yeah. It happens that way from birth. And you will see, what you would consider more feminine male or more what you would consider masculine female, even in the mainstream now. And people automatically assume that they're a transgender athlete, and that's just not the case. That's how they were born, and so on and so forth.
Right.
And I think having more talk about this, and this brings it up because it's hard to keep kids away from this because influencers, celebrities, all of that now is the forefront, right? How do you talk to your kids just about their own bodies and to go more complex with this, opposite sex parents with their children through development too, right? Because a single household family, single father, single mother, how do you go about that?
Just tell them what it is. I don't know. Yeah. I don't know how it would be.
Well, I think the parent might have to do their own education first, right? I joke of like I don't remember much from high school, and I obviously took biology, but I don't think we went into what we went into part one. I think we went into like we have a pelvis. Moving on.
I think what's the statistic? Like it's like 78% of high schoolers will know more about like frog biology,
right,
than like a female biology,
right.
Like,
so we have to educate ourselves first of it, and just work through that ourselves of just like if we have our own issues with it, of understanding, and then if we're around children or anything like that, then we can kind of just start normalizing it. But it comes from you first. I'm seeing you with your kids. It's like you're so comfortable with it because you're just like it's just matter of fact. Like it's not a big deal.
Yeah. I do have to kind of like just remember if like their friends are over. I mean, I love just going to anatomy lesson with them as well. Like I'm not upset about that if it happens, but. Like their friends' parents also know,
sure,
Kelly's a pelvic floor therapist. Like, I mean, and these things aren't like, gross or weird or they're not sexual at all in nature because like there's no name to it. There's no attachment to it. But I just want them to know kind of what it is. And if they ask, like I would never talk to another person's kid, without them saying anything. Right. But it was more like, if the time was right or like the moment was, they asked and like, it's okay, sweetie. Like, this is what you have. Like, are you okay? Do you want to talk to your mom or your dad? Or do you need to tell a doctor about something?
Right.
But I haven't really had, even with a 7-year-old, I haven't had like a little girl kind of come up and ask me anything that wasn't like provoked, like being in like a class with me or something.
Sure.
Like, there's been a more formal nature to me meeting random kids. Usually it's like they've been, they're a patient of mine and I'm still instructing, like we're going over constipation or potty, not necessarily potty training, but just the constipation or like leakage, bedwetting, and you're just having like the conversation with the parents, both parents or one parent, whoever, and that child of just, this is what it is. Like, mommy has this, daddy has this, and like
I think this is why we want to do this whole show is to reach out more people, because I don't think our show is going to be on YouTube Kids, which is fine.
If we have those puppets, though, and those stuff, then maybe the stuff is there,
They're so nice.
But if, parents are listening and just seeing us just talking about it matter-of-factly and they're getting some information, I'm hoping this breaks the stigma of our genitals aren't directly linked to sexual things. Like, we can talk about our reproductive systems, our genitals, we can talk about all just the body parts and it not be tied to sexuality.
That's a phenomenal point right there, Dr. Leslie, because I think the talk is always attached to talking about those parts, right? So
Yeah.
what you're saying now is saying that I can have a talk to my kids about their sexual organ or their reproductive organs, right? Well, even that's so sexual, but
Yeah.
their organs, all
Their
their
organs.
parts, all the bits,
All the parts.
Yeah, without going into what connects how things work. It's just, and one thing, Dr. Kelly, is you said that you talk to your kids kind of like matter of factly,
Yeah.
and that makes you wonder, like, so would you say, generally speaking, here, it's better to just kind of, again, nonchalantly just kind of talk about it as you would, how's your day, everything, because I feel like when we have the talk, right, or those types of things, it's closed door, it's serious, like, listen, and the energy changes,
Yeah.
which I think maybe for kids can go back to feeling like it's a disciplinary thing. They're talking to a principal or a
Right.
teacher or whatever
Right.
it is.
Right.
So talk to me a little bit about just like the environment, what you would recommend for a good setting and
Sure.
tonality when you talk to your kids.
Well, I think it's also the age you start with, right? If you start
Yeah.
younger, right, of like if you're
Yeah.
potty training the kid,
Yep.
right, of it's like instead of saying I'm wipe you, let me wipe your vulva, let
Exactly.
me wipe your anus, let me like you're
Exactly.
just calling it,
What it
for
is.
girls you want to wipe front to back so you
Yep.
don't get infections, and same with boys. Like I think
Mm-hmm.
it just starts the earlier you start with it, they're just going to be like, okay.
Yeah, I don't think it's really even like I mean I'm hoping I don't have to have like the talk or a talk, because it's really just been, if I am like on my period or something, because like we're kind of past the potty training, so now it's like, yeah, like there's blood, and like at first I think she kind of said like, mommy, like there's blood like in your butt, and I was like, actually no, it's
Yeah.
not in my butt, but she was like a little bit younger, so I kind of just like left it at that, like nope, it's not coming out of my
Sure.
butt, and then she just kind of like went off and did something else,
Right.
because she didn't have the attention span to hear a whole lecture on menstruation and periods. I was like, that's fine.
Right.
You're like 4, whatever you were. But now, I can ask her like, can you go get me a tampon? And she will bring back like the correct thing that I need,
Right.
versus like
Incredible.
a pad or a liner. And it's just that I've just been having, I have this conversation every month,
Sure.
so it's, but
Unfortunately.
I'm not making her like sit in the bathroom with me like for every single,
No.
tampon change, but it's just if she sees me or we're at Disney World together and like we're in the same stall or something, like it's,
Yeah.
might as well just kind of like talk it out loud and everybody at Disney World gets to hear what's
Sure.
going on in my head.
Sounds like you should make an exhibit at Epcot or something like that.
Right.
My moving body.
I know, yeah. Whoever follows me in the bathroom is probably just in for like a whole,
Well,
a whole thing.
It's fine. I think it always goes back to just like we're just trying to, if you just normalize it from the beginning and do work yourself so you can normalize it from the beginning. And not even just have kids. Like I work with couples and it's just like normalizing being able to talk to your partner, which we'll get more into in our next
yeah.
section of so you can talk to each other about stuff and it's just normal. Just like if I would say like my neck is hurting today to my husband, I should say like, my uterus cramps suck today.
Yeah.
Right? Or
Yeah.
or like my labia is a little sensitive because we went horseback riding or
Yeah.
whatever it is. It's
Yeah.
more of just like we've had in our society that these terms are just like under hushed tones, and it's just I'm hoping for kids that are growing up and parents are being more open of like we can break this stigma, and it's
Absolutely.
just body parts
That's all it
and
is.
sexuality is separate. Like it's our
Yep.
whole body and taking ownership of our whole body, and it doesn't have to be a direct line to talking about our sexuality.
No, and then we'll just be hopefully healthier, happier, confident
Right.
people.
Better friends, better ally. Everything.
Yeah.
I just
Yeah.
imagine when you said your daughter
Yeah.
knows what products to get. Imagine I have to think that she's probably more advanced than most of her friends as far
Sure.
as how all that
Sure.
stuff works.
Yeah.
What a great friend to have when
Yeah.
her friends are start going
Right.
through things and they may not have had the same
Sure.
education or trust. That's
Or
a wonderful-
normalizing it for your son.
Yeah.
It's like I've
Yeah.
heard so many horse races where their boyfriends or husbands won't go buy
Yeah.
tampons in the store.
That was
the
like
box isn't gonna bite you.
No.
No, I'm gonna tell you, as a hetero male, right? I can tell you, guys, listen, it gets you brownie points when you know what the products are, and you're not afraid. Back in my dating, life,
Right.
that always, extra points there, right?
No, I did heard from a client once of they wanted lemon or lime flavor because it was the yellow or the green.
Oh boy.
And I'm like, well, that's a funny way to break the tension. But I'm like, just remind them that they're not scented.
Yeah. Yeah. No sense. No dyes. No nothings.
But I think next time we're continuing talking about pelvic health
Yeah.
from like a health and sexuality standpoint. So We got the
excited.
basic terms, and now we're going
We can dive a little deeper.
dive deeper.
Was that a pun?
Tuned. Yeah.
So
Stay tuned till
Stay
next
tuned.
time.
Love it. So good. All right, outfit change. Y'all are rocking this. Are you? So tell me this: was this you being nervous still, or would you? Do you? Are you? Where are you at right now? Are you comfortable or
my hand is
nervous?
still freezing and I'm like still nervous. All my blood is like inside of my body.
So I was gonna say it does not read as nervous energy whatsoever.
I would say about